Okay, welcome everyone. I'm going to get us started right on time. We have a very full agenda, so I want to make sure we don't waste 1 minute. We have a great participation rate already, so I want to thank you all for your time and welcome you once again. My name is Gemma Oberth. I work with the Global Fund's Community Rights and Gender Strategic Initiative, which is very focused on making sure we have meaningful engagement of civil society and communities in Global Fund processes, which is what today's session is all about. We have 3 objectives for today's webinar. The first is to share information with all of you from civil society and community surveys around the barriers that COVID-19 has placed in terms of meaningful engagement. There are many, but this information has been key to help us overcome them. We're also going to highlight good examples. That's why it's called rain or shine. We know COVID is like the rain, but there are a lot of shining examples of effective community engagement just despite these difficult times. So we're going to share those, and hopefully that will have some lessons for those applying for Global Fund funding next year. We also aim to promote cross-regional learning. This is a global event. You can see people from all over the world are here. And we have presentations across 6 different regions, which will give you a sense of good practice in one place that can be replicated or adapted in another. I won't go through everything in the agenda. I think you have all seen that in the invitation. But just to highlight that we've got a very diverse set of presentations coming from the MENA region, the LAC region, Asia Pacific region, Anglophone and Francophone Africa, as well as the ICA region. So we really hope this will give you a flavor from all these different parts of the world for some of the challenges COVID-19 has placed on communities engaging in Global Fund processes, but also their solutions and what we can learn from this. So, with that, I'm going to turn over to Kate Thompson, the head of the Community Rights and Gender Department at the Global Fund, who's going to say a few words of welcome for us. So Kate, over to you. Thanks very much.
Thanks so much, Gemma, and good day, good morning, good afternoon, good evening, colleagues. We're really excited to welcome you all today to today's Global Roundtable on COVID-19 and community engagement. And I'd like to thank our 6 regional platforms who are really our partnerships in the Community Rights and Gender Strategic Initiative for this great collaboration. As I think we've seen, all of us will have seen, COVID-19 has really forced us to rethink our work in extremely profound ways. Many of you will have attended the regional roundtables that took place earlier this year to understand how service delivery was being affected and to share some of the innovations in grant implementations that were happening on the ground. Many of you may also have read the technical review panel's statement, equally warning of the longer term risks associated with the erosion of health-related human rights and of community engagement, 2 of the central principles of what we're trying to achieve as a global fund. So, moving forward, if we're going to be able to respond effectively to the 3 diseases, as well as to COVID-19, we're going to be depending on the insights and the leaderships of communities who are most affected, those communities who all of you work with and represent. So the partners speaking today, and Gemma talked about the range of partners that we have, which is really exciting. our partners who've worked tirelessly for the past 8 months to ensure that this is happening. And I really want to commend each of these partners for their tremendous efforts over the last period in what has been very difficult circumstances for everyone concerned. So I really hope that you enjoyed today's session, and thank you so much in advance for your participation and engagement and partnership in what we're all doing. So thank you, and back to Gemma.
Thank you so much, Kate. We really appreciate that welcome and setting the tone, and that this session is really building on a series of roundtables that the Global Fund and its partners have been hosting. So we hope to continue that learning. All right, let's start our global tour in the MENA region. So I'm going to hand over to our colleagues Elie Ballin from M Coalition and Roy Joachim, who works with the MENA Regional Platform, who are part of the CRG Strategic Initiative, to tell us about a survey they've conducted and how that is helping to tailor the response in the MENA region. So I'll stop sharing mine and over to you folks there in MENA. I've enabled the sharing function now, so you should be able to, you should be able to unmute as well. There we go.
Hi, Gemma. Hi, everyone. Thank you for this. It's a pleasure to see such many familiar faces, and it's really an honor to be participating and speaking today. I'm going to be sharing a little bit before going into the study, which my colleague Roy will talk about. So just to have a bit of an overview of some of the obstacles that COVID-19 brought up to the table that we didn't expect. For us working with queer people, LGBT and key populations, the loss of community spaces was a real blow. People were not able to meet in safe spaces outside their homes or their work where they can actually interact with others and find community support that they need. The loss of livelihood really has affected a lot of people in terms of their priorities, and health went down that priority when people were thinking of food, thinking of one of the major issues also is the policy reform that just went on hold. So a lot of government offices and spaces are closed. So all ongoing petitions and policy changes have been halted or have been regressed for some while. And with that, we also saw the increase in violence, specifically domestic violence, throughout all regions around the world. In overcoming COVID-19, there also was a few things to consider. That going digital is really not the answer for everyone. We really saw how many people did not have access to mobile phones, to stable internet. A lot of people's work was obstructed, but also their access to finding support as well. We also realized the importance of universal health coverage and task shifting, where civil society can really take on more role in helping support the HIV response and other diseases response as well. The sustainability of livelihood services is now at stake with the replanning going on for everyone with different donors. This is the cross point where we have to think of the livelihood sustainability to keep our populations alive. And just to close my intervention about the examples of engagement for Global Fund funding during COVID-19, we actually fulfilled a full transgender needs assessment in the MENA region in 14 countries entirely under COVID. We tried our best to keep it by distance, to reach communities in creative ways, and we will be launching this study very soon. But through this study, we were able to conduct the first ever transgender community dialogue for the Global Fund in Tunisia, leading up to the development of their proposal, which I think was an amazing thing, that we could first do something like this in the MENA region, and second of all, this happened during COVID. So I still think there are creative and innovative ways that we can still be able to continue our work and to provide effective engagement of our communities. I'm going to hand over to Roy Joachim, our colleague, who's going to dive more into the HIV, people living in the HIV study in the MENA region. And thank you, everyone.
Thank you, Eddie, and thank you, everyone. My name is Roy Joachim, and I'm an independent consultant. I've worked with the MENA regional platform on this study, which I'm going to present shortly. And then this study, as I said, is something that is only a tracer that we will build on for the future to address some of the constraints and challenges of COVID-19 in the region. So, the study was conducted between the months of July and August 2020, which comprised 47 online questionnaires and 5 interviews with resource persons from the region. It's worth mentioning that during this period, the region was just going out of what we call the first phase of the COVID-19. So people were just trying to understand what happened and to see how they have lived through this experience. So we tried to assess the socioeconomic impact on key populations, the emotional and physical well-being, access to services, effect of the confinement on the key populations, and access to basic commodities, including food and medications. So without going into all the details, because you have the slides in front of you, but we just highlight few of the findings that we think would be important to look at when designing new interventions in the region. In terms of income, we had 36% of the participants who have reported loss of income due to COVID-19, and 38.3% were worried about losing their jobs in the future due to COVID-19. In terms of effect on people living with HIV versus not living with HIV, we could see that less people living with HIV were concerned by the loss of income. In terms of emotional and physical well-being, I think what's most striking is that 44% of people living with HIV versus 22% not living with HIV reported being subjected to increased stigma and discrimination. While in terms of physical violence, people living with HIV were less concerned compared to those who are not living with HIV, with 37 versus 45%. In terms of access to basic commodities and medications, what's striking is that almost 60% of people were worried about the shortage in essential medications due to COVID-19. And in terms of effect of the restrictive measures and the confinement, we compared the period of the confinement to the 7 days or 1 week previous to the time where they responded to this questionnaire, and we could see no difference between the two periods, meaning that people have still dragging with the issues of anxiety, of depression. Perhaps the loneliness has decreased after we got out of the confinement, but in all other measures, in all other factors, people are still, were still months after the end of the first confinement living with these issues. What's also most important to note is only 17% of the people had access to professional psychological support during that period, which also tells us a lot about the gaps that people in these regions are facing concerning psychosocial support. In terms of access to services, here we have a major concern because 38% of the people living with HIV have concern, didn't go out because of the fear of exposure to COVID-19, while 32% had difficulties in accessing the service, and only 26% were able to liaise directly with their doctors. So in terms of responses, we could see that communication was a key element. So in terms of the survey, 92% of the people who we surveyed said they've communicated regularly during this period, whether it was neighbors, friends, or family, and 60% were engaged in some sort of communication. However, when it comes to communication between organizations and their beneficiaries, there were lots of challenges because they were not ready to structure this communication in a way that ensures the continued communication with the beneficiaries. Some of them set up social media platforms or were using like WhatsApp or Zoom to connect with their beneficiaries. But as one of the persons told us from the region, they had no direct interaction with the beneficiaries. They only had echoes of their problems. So that was also one of the major concerns in terms for the future, how to ensure continuous communication. There were lots of initiatives in the region led by the communities, whether in supporting with the distribution of food and medication to people living with HIV, whether they work with the ministries of health in the region to ensure that they could circulate during lockdown to provide home visits for people living with HIV or to distribute OST for IDUs. Also, some patients were switched to alternative molecules and regimens, and with a multi-month dispensing happening in some of the countries. Looking forward, one of the questions was to identify the areas where people should be working on or addressing in the context of the COVID-19, whether in the context of a second wave that we are currently living or under a new epidemic of a different sort. So they identified 7 areas, including providing personal protective equipment, access to services, financial support, social support, access to psychological support, access to information, and we have a 92% of people said they would like to have a consistent, clear messaging about information related to COVID-19, how they protect themselves, are they more vulnerable because of their situation, and getting food support. So these were the priorities identified for the region. Based on this, the platform have awarded 3 grants on a competitive basis to 3 NGOs, 2 in Egypt and 1 in Algeria, to understand a little bit more about the impact of the pandemic on people living with HIV at the country level and how to improve access to information, but also how to actively engage the communities in defining what type of modifications in terms of service delivery should happen, whether for HIV or for TB. Thank you.
Thank you, Mina, colleagues. A very, very interesting survey. We don't get much information from the region like that, and it's so valuable to help us tailor our programs accordingly. Very well done. Now we're going to fly all the way across the world to Latin America and the Caribbean region. So please, you can get your slides up while I'm introducing you. From the LAC region, we're going to have Violeta Ross share as an experience from Bolivia. So this is also some good practice sharing about how people living with HIV in Bolivia were able to engage in Global Fund processes during COVID, and especially to make sure that our response to the 3 diseases remains on track during the reign. So over to you, Violeta and LAC platform.
Hello, everyone. Thank you so much. So my name is Violeta. I am the president of the Bolivian Network of People Living with HIV and AIDS, and I am also the main delegate representing people with HIV in the Bolivian CCM. I'm going to explain the actions that we took regarding 3 topics. We can just go ahead with the next slide, please. So we had 3 main issues because we had many. One was related to ARV medications. What was the problem? We had a great risk of reallocation of public funds. Currently, 90% of antiretroviral medications are paid for the Bolivian government, but we had difficulties in transporting the medications, especially for people living in rural areas and areas that were not close to the urban zones. And we also had illegal markets of Caletra because there was a rumor that Caletra helped preventing COVID. The second issue was CD4 and viral load testing. We had a great delay on access to these testing services before the COVID pandemic, and which was even worse in the COVID pandemic. Also, the Bolivian government used the laboratories for COVID testing, and those centers are no longer testing viral load, but they are testing COVID only. Also, the Ministry of Health in Bolivia issued a recommendation in order to use the Gene Expert machines that we purchased with the Global Fund money for COVID testing. They didn't ask us for this recommendation, but when we knew, we of course we opposed. We used the media and tried to avoid the damage. And the third issue we had was economic challenges and hunger. Most people with HIV and people from key populations were experiencing a lot of difficulties to face their own food and for their families. There was no possible way of keeping up with the economies working on the streets. Many of the people living with HIV and those from the key populations are in informal jobs, which happen on the street. And because of the quarantine, they couldn't go out. The next slide, please. I don't see the next slide. Okay, so what we did in relation to these three topics. Medications was the most important. We demanded the National HIV Program to issue a recommendation for the continuation of ARV distribution among people with HIV, even for those who were not residents in a given city. Many people were kept in the middle of the restrictions, and we needed to provide them medications. We also ask the principal recipient to use some cards that we use for primary prevention with key populations, but this was not happening during the lockdown because of the restrictions. Usually these cards are used to bring testing and condoms for key populations. They bring it to the bars, to the discos, but these services were not being offered because of the restrictions. And so we asked them to use the cards to move the medications around, at least in 3 cities in Bolivia, and it was accepted at the end. Regarding viral load, of course, we oppose the recommendation of the Ministry of Health, and we demanded a guarantee that the viral load testing for people living with HIV was going to be the priority before any consideration of testing for COVID. And with the last part, the one on the food and food supply and support, we asked the Global Fund to include this in the next proposal. It wasn't so easy at the beginning, but at the end we got it, and we are going to implement this very soon. Next slide, please. So what changes and what success can we tell you about? Well, we had no interruptions on the ARV medications. At least we had 2 months supply. In all the country, we made a survey. No gene expert machine was at the end moved out of the HIV centers. The National HIV Program decided not to do this because they understood the guarantee of the companies was going to be valid only if these machines stayed in the HIV centers. And regarding the economic challenges and hunger that people with HIV continue to experience, we included this in the Global Fund proposal that is going to happen very soon. Of course, we couldn't include everyone who needs support, but at least a great amount of people will be supported with food supplies. Now, one question that I leave for the debate is, how does transition look for in countries, in regions like Latin America, which were already transiting off the Global Fund, but after the lockdown and the impact of the COVID pandemic, I don't think it's going to be as easily as it was in the past. We need to have a conversation about this, and this is my last contribution. Thank you so much.
Thank you so much, Violetta. That was a fantastic presentation. Great to hear of some advocacy success stories and how the Global Fund grants are helping respond to the 3 diseases and COVID at the same time and the issues you're facing. Thank you for sharing. That was very, very well done. Okay, getting in our planes again, because we can't fly. I'm pretending that we're flying around the world right now. Getting in our planes again, flying back to the other side, to Asia Pacific. We're going to hear from R.D. Marte, Executive Director of APCASO and host of our regional platform in that area, to tell us about some of the learning in her region. Over to you, R.D.
Gemma, Saavedra here from Latin America.
Sorry, George. Yes, George is just going to make a short remark, R.D., and then to you. My apologies.
Sure.
Yes, Jorge, go ahead. Sorry to forget.
Okay, so fly back to Latin America. I'm Jorge Saavedra. I'm a member of the delegation of Developing Country NGO, and I was going to make some comments in reactions to Violeta's presentation on what they have been doing in Bolivia. As you know, as part of Latin America, what has been done in Bolivia is a reflection of community engagement, and we can do even in these terrible and difficult circumstances that we are facing in Latin America. You probably don't know, but Latin America is the most affected region of the world by COVID-19. This morning, we woke up with 11.4 million cases of COVID-19 in Latin America accumulated and more than 400,000 deaths. So our countries are severely affected by COVID-19. So efforts like the ones Violeta showed to you are really remarkable and heroic, because people are dying here, like thousands and thousands. I can also tell you about Mexico. We have 4,000 AIDS-related deaths per year. And right now with COVID-19, we will have 100,000 COVID-19 deaths. So it's impacting here. So we know that Latin America is the less important region for the Global Fund, because we receive around 3% of the Global Fund funding. But under this situation, it's a severe, difficult times for Latin America. I can tell you that my neighbors who live on my right side of my home, they are both dead. My neighbors on my left side, the four of them have been ill. My plumber is dead. His wife is dead. So every day we learn about people that we relate to are dying or getting infected. So it is a challenging situation, and that's why Violeta's last question is really meaningful for Latin America, because we really think that sustainability, transition, and co-financing, especially transition, should be frozen at the Global Fund in order to help. Yes, from communities and civil society, we can do a lot, but it's unsustainable under the current situation of Latin America. People are dying, millions are getting into poverty, the economy is collapsing of all our countries, from Argentina to Mexico, including Brazil and Bolivia as well. So this situation that we can do from communities and civil society are good examples, but are unsustainable. So the call from Latin America and Latin Caribbean will be stop transition immediately. Stop all the transition efforts immediately. Forget about it. Let's talk and discuss about it after the epidemic is under control, under this pandemic is under control, and that's the best way to move forward. But in communities and civil society, we can help and we can do a lot, as Violeta just showed in the case of Bolivia.
Thank you. Thank you, Jorge. Thank you for sharing with us some of the advocacy that the delegations are thinking about at the global level. Thank you for the intervention. Okay, back to Asia Pacific. RD, the floor is yours. You have your time now. Thanks very much.
Thanks again, Gemma, and good evening, everyone from Thailand. So just sharing a few top-line lessons and experiences from the Asia Pacific region. We were allotted 7 minutes each, and I'll try to stick to that. So I'll not go into details, but I'll refer and leave with Gemma some references of the studies and surveys that were conducted that do have specific recommendations, including those that are oriented towards the Global Fund that relates to communities' rights and gender issues before, during, and after the pandemic. So I remember sometime in March, as the world was closing because of the lockdowns due to COVID-19, the APCASO staff team was actually in Papua New Guinea, in one province called Leh. And Papua New Guinea, if people are not aware, is in the Pacific Islands. At that time, the staff team was concerned because we were receiving news of COVID-19 threat, and then the borders closing. We were worried that we will not be able to return to our respective home countries. But anyway, we proceeded because we needed to do interaction and engagement with the local community that work on TV. At the same time, when we reached Leh, the province we were a bit sad because we weren't able to engage with the TB community, and there is sad because of that, but at the same time happy because the reason why a number of the TB community representatives weren't able to meet with us was because they were out in the community already responding to COVID to provide information. Even if they were a community of TB advocates and volunteers, they were actually mobilizing themselves and going to their communities to be spreading information and support related to COVID. In Pakistan, as early as March this year, the National Positive Network, the Association of People Living with HIV in Pakistan, together with the UNAIDS Country Office and the National AIDS Control Program, as early as March, it set up an emergency response cell. And this is to make sure that those who are on ARVs get an adequate supply of meds in the event of a lockdown, even if this means delivery of door-to-door supplies as needed. In Vietnam, a national civil society organization that serves as a hub for supporting different community networks across HIV, TB, and malaria, led and mobilized communities across the key population networks for food and mass collection and distribution for street dwellers and homeless people. In the Philippines, we have been hearing cases of sex workers who were put in jail because they needed to resort to stealing in the absence of work and clients because of the lockdowns. We know of a group, our country partner, Achieve, which mobilized collection of money to help bail out members of sex worker community who were put in jails, as well as to provide food support to those in need. In Nepal, the network, the national network and the provincial level network of people living with HIV organized themselves to do door-to-door distribution of ARVs, so to ensure that there will be no disruption of medications. They reached the farthest level to the community, even if there were at some point danger of stockouts, and they also did advocacy to make sure that that did not happen. At the same time, in Nepal, despite the difficulties imposed by the lockdown, they were effectively able to mobilize community engagement in the country global fund, in the country dialogues for the Global Fund concept note development. They did over 100 online physical consultations among community members, and this led to a robust concept note that includes components of community system strengthening, advocacy, and all the things that they felt was needed for an effective response. I won't go through the challenges that was experienced by the region as reported by our partners because of the COVID-19 pandemic, because we have 7 minutes and I think I will need 100 or so, at least minutes for that. But what I was trying to demonstrate in the country examples, and these are not the only one, we know of similar stories happening across the other countries in the region, is that yes, there were a lot of challenges to human rights, challenges to access to services, challenges to mobilization, to HIV, TB, and malaria communities that have been brought on or have been magnified by the COVID-19 pandemic. But we also know that community and civil society, those were investments in community system strengthening were made, have found ways to surmount and overcome these challenges. It has been the HIV, TB, and malaria community systems which we've seen used to also respond to COVID. It has been the HIV, TB, and malaria community-led leaders which we have seen leading in the Asia Pacific. And it is the same community and civil society networks which mobilize themselves and step up to do community outreach, that's in terms of advocacy, information, providing medicines and other needs of their community, to protect their own constituencies, to look holistically at the issues and needs of their own communities, and to evolve new ways of responding when they face restriction because of the lockdowns. So those were the short-term immediate responses that we've seen mounted by communities and civil society, but we've also seen more responses that are looking at the longer term. So they're at different levels, and these are a few, which were more APCASO and partners-led. There have been a documentation, a proactive trying to gather the experiences of community and civil society and the challenges during the COVID-19 pandemic, and how this is affecting key vulnerable and marginalized populations, framing the issue from the perspective of community and civil society, formulating policy recommendations, and finding spaces to actually provide those recommendations to those which need to hear it. So all of these resources that are in front of you on my screen are available in the APCASO, APCRG, and Partners Info Resource website. We had one that is focused on the first one, Asia Pacific Rapid Assessment on Key and Emerging Issues faced by HIV, TB, and malaria-affected communities during the COVID-19 pandemic, and it has specific recommendations to the Global Fund. There was also a survey conducted by a partnership, including APCASO, on the impact on the mental health and quality of life of COVID among young key populations in the Asia Pacific. Our country partners in Sri Lanka did a similar study focused on key populations, and it's also touched on mental health. These were things that are done with concrete recommendations, with concrete also plans for follow-up action. And just to note that aside from this, there are a number of emerging in the pipeline plans for regional stakeholder dialogues focusing on UHC in the context of pandemics and post-pandemics, mental health, community and civil society, how do we navigate and operate in this new normal, as well as the issue of homelessness and foodlessness and social economic preparedness amongst vulnerable preparations in the region. So a mix of immediate responses for immediate needs of communities, as well as long-term policy-oriented thoughts and movements by activists in the region. My last slide is just what all these are telling us. And this is something that won't be new to us. It's the fact that investing in community system strengthening is critical. We need it. We need it not only to be said in principle, we need it to be funded, we need it to be operationalized. Global Fund has it in its guidance documents, but it needs to be effectively operationalized. We have seen from the examples and we have seen from the realities of our partners in the countries that communities and civil society have the ability to effectively navigate amongst challenges. Either it's in a pandemic context, either it's in a human or disaster context, etc. A pandemic merely amplifies the strength or fragility of community and civil society systems to engage and mobilize. For example, when you talk about country dialogues, pandemic or no pandemic, if country community systems are weak, they wouldn't be able to mobilize and put forward strong recommendations towards their concept note. If they are strong to begin with, even if you throw them a pandemic situation, they'll be able to navigate that, find own ways that work for their community to lodge effective responses and input, the way that we've seen a number of our country partners did in their countries. Just a last point is that outside of the COVID-19 pandemic, like the Asia Pacific region, probably similar to the other regions, it's a hub for earthquakes, for volcanic eruptions, for typhoons, for political instabilities. So outside of the COVID-19 pandemic, we already know that there will be more in the future, and there have in fact been other crisis situations. Therefore, countries and the region, and this includes the community networks, the CCMs, governments, other stakeholders, need to actually have crisis situation standard operating procedures and guidelines in place. And of course, like nothing of that would be effective if you don't have community mobilization and community at the front and center. That's all for the Asia Pacific region. Thank you very much.
Thank you, RD. You did a good job sticking to time. Very well done, and use very useful reflections from your region about the importance of the resilience of community systems in the face of such situations. In my haste to keep to time, I neglected to mention that we have some translation happening in the chat. Our partners, the regional platforms are doing some translation in Arabic, Russian, French, I've seen so far, maybe Spanish as well. So if you want to have a dialogue in a language you're more comfortable with, there are people monitoring that who can respond. We also have a audio francophone translation. Thank you, Ida and Simon, for the link. On Google Meet. So if you are Francophone and you prefer to join that link to listen, please feel free. Okay, our last short presentation, and then we will open up for some questions and discussion, is from Gilles from Global Fund. He's going to present a short summary of community engagement in the COVID-19 response mechanism funding requests. So over to you, Gilles, and thanks very much. If you can make it to presentation mode. That will help.
Thank you, Gemma. Thank you all. Can you see my slide?
Yes, if you can just make it presentation mode, it will help us to see full screen.
I think it is in presentation mode, but is it better now?
There we go. Thank you.
Perfect. So yes, thank you. I will try to be brief because we have 2 minutes before the Q&A. So yes, my name is Gilles. I joined CRG at the Community Rights and Gender Department 3 months ago. I was a fund portfolio manager before that for 6 years at the Global Fund. And I'm presenting briefly the COVID-19 response mechanism survey results that we have launched in September. We had 300 respondents approximately from all the regions and across different CCM members, representations like NGOs, CBOs, very little from the youth organization though, this is worth to mention. Overall, 76% of the CCM members felt that they had timely and relevant information on the COVID-19 response mechanism, but only 35% from the non-CCM, meaning that there is a gap in communication between CCM members and their constituencies in the process, which is explained by many of you in terms of lack of time, lack of IT tools to engage, etc., etc. So when we look at how people were involved when they have been informed and when they have been engaged, you can see that mostly people were consulted on what the priorities should be, but very, very few of you were involved in writing sections. If you look at the bottom of the graph, writing section of the request goes very low. Only 14% said they were engaged in that. And as well, only 15% engaged in costing and budgeting. And we know that this is very important when you want to see your ideas reflected in the request. So, not surprisingly, then half of the respondents said that their priorities were not included in the funding request. We also have seen that 32% of the CCM members have actually not seen the final request before it was submitted. And well, if you look at the right side, sorry, went too fast. You can see that as a result, only 25%, for example, of the funding request included some investment proposed for GBV or IPV, and only 27% for social protection. And then my last slide is, and I'm going really fast, I'm sorry, but it's really recommendations we got from you during the 4 consultations we had 2 weeks ago following the presentation of these survey results. So this is a list here of what we've heard we could do on the process and on the content of the funding request if we have a next phase. So of course, ensuring more time, youth engagement, and time for feedback from constituencies, clearer message from the Secretariat on how important it is to involve not only principal recipients and governments, but everyone, and include funding for CSS, GBV, support to key and vulnerable populations, including economic, psychological support. Support for virtual engagement is important as well. Be public, information public and transparent, such as CCM websites, Global Fund websites, and very important, adapt the application materials to highlight CRG investment possibilities in there. And also in the template so that we can measure the CRG investment easier. And then very quickly to end here is what we've heard again from you is maybe some takeaways as, shall we provide more, like being more prescriptive with a percentage maybe for funding to community-based organizations? Can we, given the diversion of human rights, human and financial resources from TB to COVID-19, for example, shall we encourage more proactively, community-led monitoring and service delivery? And also we heard a lot the request from you to provide more evidence that CSS works and that CSS is a good investment. And so that was needed to help communities advocate during CCM discussions. So this is really the takeaway from this survey. And I'm going to send my email in the chat. So if you have any other idea on how we can improve the process and the content of the next phase, please send them to me. Thank you.
Thank you so much, Gilles. Very interesting to see the engagement in this Global Fund related process as well. Some similarities to the regular funding requests, but some new challenges as well. So we're going to open up now for a discussion for the next 17 minutes or so. We have a couple of questions in the chat. Feel free if you would like to ask a question there. You can also raise your hand if you'd like to make an intervention. I see we've had a couple of comments so far. I will just share those from the chat box. One is a question from Enrique from Frontline AIDS asking, jumping onto Jorge's comment about sustainability, talking about, should we look at eligibility as well? We know what COVID-19 has done to exacerbate inequalities, especially in these middle income countries, a thought-provoking question. And another question from Deepanjali around the C19RM requests, really wondering what were community priorities included? And this can be for others to respond to as well, or our panelists. Were civil society issues included in those funding requests? Or do we even know? As Gilles said, we maybe didn't see the final one. Okay, let me take the 3 hands that are up now. I think it's Leslie who's there, or someone from Developing Country NGO. Please go ahead.
Hi, Gemma, thanks. It is Leslie. Hi, everyone. So lovely to be in this space and see you all. I'll be quick. This is, so as you all know, right now, well, maybe you don't know, but basically next week is the Global Fund board meeting, and it's the final board meeting for the year. And the information that's being shared on this, I mean, I did know of some of the cases and, of some of the work, and you pick up pieces, but the information being shared on this webinar is so valuable. And, we are literally writing our position paper. I'm supposed to be writing it right now, but I'm with you because it's just so rich. And so with your permission, I'm going to reach out to Gemma and literally ask for all the presentations. Like, we need to, in our delegations, we're consistently, and we're pushing in the strategy development, and we're asking these questions around the COVID-19 resource, whatever it's called again, RM. And, we're asking what is going to communities, what is happening, we need this information. So I just want to really, anytime you have any of this kind of information, please, it's also partly my fault, obviously, if you don't know, that you should reach out to us so that we can take this to the board, because also the board retreat is happening as we speak on strategy development, and this is all really important as we push for communities and civil society. I'll stop there, thanks.
Thanks, Leslie, glad it's useful. Mick, you're next, please go ahead.
Thanks. Yeah, I just got a quick question for Roy. From Mina. I just wondered if you mentioned OST and people who inject drugs, but I wonder if you spoke to any sex workers in your survey, because they are particularly hard hit by COVID because they can't work. And so I'd just be interested to know that. I took something different than what Jorge took from Violetta's presentation. I actually took that how easily core functions of the Global Fund, HIV, TB, malaria, have been set aside because of COVID, and it needed community advocacy to put it back on track. And I think that's a question the Global Fund need to think about. I was really pleased that RD raised the specific problems that sex workers face around gender-based violence, imprisonment. But COVID, what I took from RDs was COVID hasn't really brought anything new. It's basically amplified problems that already existed. And I think that, for me, I think we need to address those problems more specifically than devote so much energy just on COVID. Because those problems that are being amplified have been there for far too long. And I think we're getting slightly misdirected in where we need to put our efforts. And finally, just from Gilles's presentation, the Global Fund has to think about a dedicated percentage funding for communities. Otherwise, the C19 RM money did not reach communities. And unless they take that on board, nothing will change. Thanks.
Thank you, Mick. Very powerful intervention. Next, we can go to Asanul from Bangladesh. Please go ahead.
I think you're on mute.
Sorry about that. Can you hear me? Okay, so what I was saying is that what Mick was saying is that representation from communities has to be improved, and I think we need to work more on capacity building, because we have a lot of interested people. We have a huge demographic people, but they cannot make good representation of their situations. That's one thing. And also another thing that COVID has showed us, something new that I've experienced from my communities. Before COVID, childbirth was almost 90%. Or 78% through C-sections in medical facilities. But during COVID times, 98% of C-sections has come down, and normal childbirth is taking place, which shows that in our society, we have a lot of systems in place that makes you drain out your resources and makes you divert into different angles that we don't really need to go. And from COVID, that is a positive thing I've learned. We can use our own resources much better if we actually reach out to the communities themselves. We can do some work on capacity building so that we can hear them, and their voice does not have to come through any representation. They can come directly themselves to you or to the Global Fund community. And also another thing about ART I've experienced, I'm a CCM member, so I keep on bringing this up in every meeting. Even myself, I have experienced, and because Bangladesh government has taken over from a lot of the NGOs working in this field, what they do now is that they support the ARTs in the government hospitals. But a lot of the times, if you go after office hours, after working hours, like in Bangladesh, after 4 o'clock, the hospitals ART dispensing unit would be closed. So someone who has to travel from far away, use a lot of their money that they don't have, and come to the hospitals, and if the hospital is closed, they don't get the medication anymore. So what I proposed, a lot of times I have said this to UNAIDS, to USAID, is to be able to have a emergency kind of emergency bank for ARTs, because obviously ART is not something that you can postpone for tomorrow or wait for 2 days because your office is closed now. So if it's possible through Global Fund, one of the things I want to include in it, I would like to see this happen in Bangladesh very much so, even if it's through private or NGOs, is to have a emergency bank where if you come up and your medication is run out and you need emergency, there can be a 24 hours support, at least for 2 days or 3 days, even for that 1 day, just to have the person on the medication and not take him off. So lockdown and ART is also a big concern, because due to lockdown, ARTs are not being able to be sent out. So we also need to work on how to make sure everybody's getting the ARTs on time. And like I said, capacity building is very, very important to have equal and sound participation and contribution towards our united goal to have TB, malaria, HIV free Bangladesh and TB, malaria, HIV free world. Thank you very much.
Thank you for that, Asnula. I really like what you said about what COVID can teach us about efficiencies as well in how we do our work. Think of a meeting like this at 200 people together. How much would it cost for us to have this discussion in person? We're also learning how to use resources more efficiently for our engagement as well. So I like that point you made. Lee, please go ahead. You're next.
Thank you very much, Gemma. I'm Lidice Lopez from Lima, Peru. And along with Alfredo Mejia and Anwar Luna, we've been collecting some information about the response to HIV through the Global Fund grants here in the region. And I wanted to share some of the findings we got, just 5 hot points that we wanted to share with you. And as Jorge mentioned it, here we find that COVID-19 has highlighted the weakness health system in the region and the fragility of the response to HIV, tuberculosis, and malaria. And most of the prevention action, not only the government actions, but also those included in Global Fund grants, were the most affected. Intervention in meeting place, provision of condoms, testing, and referral to health services were stopped at once since March. Some of the countries hasn't started it over again. So civil society organization had to play a key role in maintaining the response, offering testing, offering this referral to services. Even though the EPPs, the protection didn't come in time, but they played a key role that was mentioned also in most regions. Know how the civil society organization had played a quick response to the emergency situation, and also mobilizing food resources or also women sex workers. So we did finding we kind of support what Jorge Saavedra was saying, that we are not prepared for this transition of Global Fund. We have to work deeply in this capacity building that was also mentioned by a former speaker, trying to mobilize bigger resources to civil society organizations so they can engage significantly in the HIV response and tuberculosis as well. Thank you.
Thank you so much, Lee. Jorge, I see your hand up, but I want to just make sure we have a chance for some of our colleagues from Africa. I see they're next on the list to make an intervention. So if you don't mind, I'm going to jump you and go to Mr. Gasa, my friend from Zimbabwe. If you want to make a quick remark, please do so. We just have a few more minutes, so please be brief, Emmanuel.
Yes, thank you, Gemma. My question is to R.D. Mate. When she spoke about homeless people, I really wonder to what extent can we try and make sure that we collectively lobby the Global Fund, particularly to assist in terms of when an emergency do happen, to what extent are we then able to make sure that we've got ARVs at any disposal? Like recently in Zimbabwe, we just had Cyclone Idai, which claimed a lot of people in the eastern province of the country. We lost some people because they defaulted, because ARVs were swept away by the cyclone. So I really wonder to what extent can we expect something from the Global Fund, or maybe also when we talk about communities, we try also to lobby and make sure that we create a space for someone from internally displaced population settings to represent the communities as well, coming from that angle, so that it's a multifaceted approach, nobody's left behind. Thank you.
Thank you, Gasa. No, it's a very good point about these new, not new vulnerabilities, but exacerbated vulnerabilities, like Mick was saying. RD, can I ask you to just reply in the chat box? I want to take one more intervention before we go to the next session. I want to go to Repent from Nassos in South Sudan. If you'd like to just make a quick intervention, the floor is yours, and then we'll go into session 2.
Okay, thank you, Jim. The issue that I wanted to bring is the issue of ARV, of course, based on this COVID-19. other locations, for example, in South Sudan, the other places, the other parts is cut off because of conflict and COVID-19, which really expose people living with the HIV in a dangerous situation. For example, the issue of access to ARV is not accessible. And then the economic challenge or hardship is also have. I don't know how can we request Global Fund to have really emergency fund that can really support people living with the HIV, because it is really worse, and then so many people have died, but there is no even much research that done to find out the number of people that died of in access for ARV service, and then even hunger itself. So these are some of the major things that is affecting us in South Sudan. Of course, in South Sudan or Africa, we have the issue of capacity building for communities, because really I wanted to ask you which kind of, if we say meaningful engagement, what kind of engagement do we want to do? Are we only trying to engage civil society organization, or which kind of stakeholders that we need to engage to make it meaningful engagement? Because based on our on my experience in our country, really we are facing a lot of challenges, especially access to ARVs, because other locations has no hospital. You will just say PHCC or PHCUs, which is hard for us to reach to vulnerable people in the at a grassroots level. So these are some of the things that I would bring up, so that we see as a team what can we do to help people living with the HIV, especially in emergency situations, because other areas really, for example, like flooding areas in Jongole, in Upper Nile, in Equatorial region, really it affected people living with HIV hardened, and then they have no access for shelters sometimes. Then how can we really make it meaningful? Thank you for giving me this opportunity.
Thank you for those comments, Repent. I think you touched on something very important. The information is really what we need. We need to hear from communities what the problems are, what solutions they identify, and so that we can tailor our response. Without the information, there's nothing that we can do there. So let's move into our second session. Those with their hands still up, and I ask you to keep them raised. I know your arms will get tired, but I'll come to you first in the next round of discussion. I just want us to stay on track and make sure we don't cut any of the sessions, but you will be first up in our next round of discussion. So let's go to our second session now. This session really highlights some good examples from the region of how community engagement was done effectively under these difficult circumstances with COVID-19. Malewa, how is your connection there in Tanzania? Is it okay? Are you there? Are you ready?
Perfectly in order, Gemma.
Oh, good. I know you were having challenges with the throttling of the connection. I'm glad to hear you. The floor is yours. So please go ahead. Malewa, it works with the Anglophone Africa Platform in Tanzania, one of our partners. He's going to talk a little bit about some community surveys they've done and also some good examples of engagement in the C19RM requests. Over to you, Malewa.
Thank you so much, Gemma, for that very good introduction. So briefly, I'm going to share some experiences of community engagement during the COVID period. And just to roll us off,
sorry, Malewa, do you mind making it full screen so we can see the presentation?
Yes.
Thank you, thank you.
That's okay now? Is that good?
Perfect, perfect.
Yes. So I'm just to roll this off, I'm just going to quickly present some of the issues which we uncovered when we did our rapid assessment of how TB and malaria communities were impacted by COVID-19 when COVID actually was just in there. And just like most of our presenters have done, there was a lot of TB and malaria service disruption, limited engagement of TB and malaria civil society in national COVID response. There was this initial thought that the response was largely driven by government, and civil society were actually struggling to find space to engage. And then we had engagement in country request and grant making. Processes were kind of interrupted. TB and malaria grant implementation was also impacted. And then we are talking about a lot of stigma and discrimination, more so because of the symptoms of TB and malaria and those of COVID are very, very kind of related, high temperatures. And then, of course, lack of a people-centered approach to COVID-19 response. So if you look at the core service disrupted for malaria and TB, mainly we are talking about mostly all the community-led programs came to a standstill for a while, and that really impacted a lot. TB screening, loss of follow-up, these were some of the issues that actually came up as that led to the disruption of services during the COVID period. Now, if we look at the response that we actually took with that background, that yes, we know there was limited engagement at the initial, so how did we ensure that this process changed? And we have some kind of good examples. I just thrown you some response bubbles out there, and you can see there was increased virtual capacity strengthening. People now started actually moving in virtual to ensure that things are working, including actually supporting some communities who are quite remote with airtime to ensure that they engage in the discussions that were going on at the national level and of course at the regional level, including within their own communities. And we talked about focused and targeted TA during the fund request and grant making processes. But of all those bubbles that I've just thrown out there, I'm going actually to zero into two bubbles briefly. The region actually came up with a very innovative approach, actually developed a seed tracker application. We knew that at one time COVID was scaled down and skies were going to open as they're actually doing, but that doesn't mean it's the end to COVID. What then do we put in place to ensure that people are able to identify quickly areas of high spikes of COVID so that decision makers can be able to move there up in speed and contain the situation and avoid another further spread of COVID? So the seed tracker application was actually a community-led application that was developed within an Anglophone Africa platform. And it was intended actually to bring the response closer to the community so that the community people are able to map out people who have actually contacted someone probably who tested COVID positive, and they share this information with the service provider, service provider application. But again, you also have the policy and decision makers able to see this interaction and able to pick areas or high pockets of COVID spike so that they can actually be able to move in speed and actually contain the situation before it erupts. So it's actually an application that's really bringing the power of information sharing to the people or to the community on the ground so that they can be able to share a bottom-top approach. And then decision makers at the top make decisions based on the information that's coming from the communities. And this application actually was included in the South African C19 RM so that it can actually be able to be implemented. As we all know, South Africa is one of the regions that had one of the very highest numbers of COVID. But on the other hand, if you look at the increased number of virtual meetings, especially on engagement, especially on CCMs and during the C19 RM processes, we have a very good case that's coming from Botswana. And I know our Botswana colleagues are within this discussion forum. When we have questions, probably they'll be coming in. I know Nana is somewhere in the background. They'll be able to expand more on this. What were the key highlights on community engagement during the Botswana C19 RM? This was one of the unique CRM that really included strong components of human rights within the C19 RM and included community priorities. And there were issues like addressing national human rights response systems on human rights with updated content. They actually included issues of integrated stigma discrimination guidance, especially with COVID-19, because it also came with stigma and discrimination. There was also issues of continuous monitoring of COVID-19 response by communities and giving feedback to policymakers. So actually strengthening communities to take a much more stronger role in the COVID response. And of course, addressing intimate partner violence and the whole range of domestic violence on AGYW, women, children, sex workers, LGBTQ community. These were issues that were able actually to be put in the C19 realm. And how did they manage to do this? They actually came with a very good framework, an integrated task force that included government, civil society, and actually private partners. And in this, the civil society actually who sat in that task force were continuously engaging with their constituency, including KPs, either face-to-face or virtual, to build consensus on the potential areas of focus that should be included in the C19 RM. So this was a very good example that ensured maximum inclusion of community priorities in the CRM and very clear areas of focus that CRM should address on the communities. So what changed? Actually, to us, what changed is colorful. COVID actually has taught us a lot, and we're actually thinking virtual, and Gemma has actually talked about this. It's so difficult to hold a meeting like this of 200 people face-to-face. It would rather have been extremely costly. So during this time, we saw continued virtual learning sharing among civil society community groups beyond the funding requests and grant-making processes, because now people continue to engage and discuss on virtual platforms. Increased monitoring of the COVID-19 reprogrammed funds. Civil society wanted to know how these actually monies are used, and there is a lot of sharing through virtual platforms. Increased engagement of groups that do not have represented in CCM. I think this is the first time we were seeing a lot of civil society being engaged in CCM processes, because it is easy to bring a lot of people virtually to participate other than to have actually face-to-face physical meetings. And then we had meaningful inclusion of civil society and community groups in the C19 RM, as I have actually explained in case of the Botswana case. And of course, we talked about increased engagement of and meaningful contributions by the civil society and communities in the fund request and grant-making processes. And most of these processes were actually happening virtually. So thank you very much for having listened to me, colleagues. And we'll be ready to
Thank you so much for those examples. I mean, it's a great reminder that engagement, in community-led monitoring is such a key part of meaningful engagement. And I love the example of the C Tracker app in South Africa and monitoring rights violations in Botswana. So thank you for that, touching on that theme. We know it's so important. Okay, now over to the ICA region. We have Ivan Varentsov from Eurasian Harm Reduction Association. He's going to tell us how Russia developed their HIV funding request for window 3, done entirely virtually because of COVID-19, and how they did that. So over to you, Ivan, looking forward.
Thank you, Gemma. Good afternoon, colleagues. Yes, my name is Ivan Varentsov. I'm working with the Eurasian Harm Reduction Association based in Lithuania, and I'm coordinating the ICA regional platform for communication and coordination. And today, I would like to share with you the experience of civil society in Russia on development of the proposal for the new HIV grant in the context of the COVID-19 lockdown. So what is really important to know about this proposal is that first of all, this was the first time since 2014 when Russia became eligible for Global Fund HIV funding again, and this would be the only grant on the globe to be provided due to the provision of the Global Fund's eligibility policy, formerly known as the NGO rule, which allows the Global Fund to support the civil society in those not eligible countries for HIV funding, where the government do not take proper measures and for HIV response on the national level. So this proposal should be a non-CCM proposal. The principal recipient should be the NGO, and the civil society actually should play and played the key role in the proposal development, because it's the proposal was developed by civil society. It was overseen by the civil society, and the civil society played the key role in all related processes. And so, talking about the COVID-19 related challenges, to set the context. Due to the COVID lockdown and the travel restrictions, the experts which were subcontracted to help with framing the content of the proposal in accordance with the Global Fund requirements, they were not able to come to the country, and so they had to stay in their countries and working online. So no face-to-face meetings were possible for civil society in country to meet and to discuss the proposal, and even some people were not able to work from their offices. They had to stay at home because the active period of working on the content of the proposal was April, August, and the total lockdown in Russia was in May, June. Here on the slide, you may see the structure of the country dialogue to develop the new HIV proposal in Russia. So we had the UNAIDS regional office, which was asked by the Global Fund Secretariat to coordinate the process of the development of the new proposal in Russia, and UNAIDS they hired 2 external experts to help to frame this proposal in accordance with the Global Fund requirements. Also, global units were responsible for making sure that the proposal is being discussed and agreed and communicated to the government, proper government structure. So they established this expert advisory group for these purposes. Also, we had the civil society country dialogue, which included more than 350 participants, and the core of this country dialogue was the civil society coordinating committee, which included 25 members representing different civil society groups, communities and sectors. And actually one of the key roles in the whole process played the secretariat of this civil society coordinating committee, and the work of the secretariat was supported by the APCRG Platform, because when you have the online process of the development of the proposal and so many actors being involved, you need to have someone who is aware of all the processes taking place and who can coordinate the work of all people online. So this role was the secretary of this coordinating committee. Also, we had the 5 national key population forums being involved. Forum for people living with AIDS, sex workers forum, people who use drugs, MSM forum. These 4 forums were actually established during the implementation of the previous Global Fund grant, and they still are functional. And also the 5th forum, transgender forum, was established during the process of the development of the new application. So it was the civil society country dialogue who selected the principal recipient for the new grant, NGO humanitarian project, and also the civil society country dialogue, the forums, key population forums, they delegated their representatives to the technical working group, which actually was developing the content of the request on behalf of the key population civil society and other civil society partners being involved. So if to talk about what worked and what lessons learned we can have from this experience. So of course we had to have numerous conference calls with the members of the working group, with different experts, different parties involved, and it was the really time-consuming and resource-consuming process, because sometimes it was everyday calls for 10 hours long when people just switch off and on. And it was really important to constantly inform the members of the country dialogue on the process of the development of the proposal. So we had this online info sessions telling people about the content of the proposal, about the content of each component of the proposal, about at what stage we are now. So to make sure that people are involved, and this was about transparency, inclusiveness, and openness of the process. And of course, it was very important that people, members of the working group, they were accountable to the key population forum, so nothing was included into the proposal without consulting with the representatives of key populations. And also the very important result was that the transgender forum was established during the process of the development application in order to ensure that the needs and interests of transgender people were properly taken into account when developing the proposal. And so about the lessons learned, on one hand, due to the COVID restrictions, it was managed to save some funding, so about $30,000, which we initially planned for face-to-face meetings. But what we didn't manage to save, it's like the time, because actually we spend much more time on all these online communication processes if to compare when you have an opportunity to meet face-to-face and discuss. And one of the reasons, for example, was this absence of experts who were helping with framing the proposal in the country, because it was really difficult to work with them online, because some of them they were not speaking native language, they didn't know the context of the country, and it was something really time-consuming and impacted the quality of the process and sometimes the content of the proposal. But another lesson learned is that the civil society experts, they actually could be, and they are the resource for such kind of work, because they are motivated, they can work on, if needed, on the voluntary basis for the greater good of the community. And due to this civil society expertise and involvement, actually this proposal was successfully developed and submitted in time. And now we're waiting for the TRP feedback to finalize the proposal. That's it from my side. Thank you so much.
Thanks, Ivan. I really like what you said about accountability, transparency being so important, especially when things are virtual. You know, normally we can engage in person. We know where the meeting is happening. You can show up. So we need to be extra open and extra clear to make sure people are not excluded. Very good point. Okay, our last presentation of today's session, and then we will have another dialogue session. So very last presentation is from the Francophone Africa region. So Ida, you can get your slides ready as I introduce you. Ida Savadogo works with Jame in Burkina Faso. They are our partners for Francophone Africa to support community engagement in that region. And Ida is going to share stories, a model that they tried this year called a National Country Dialogue Facilitator Model. They piloted it in 4 countries. And then she's going to tell us how that worked to make sure engagement was happening in the funding requests during COVID. Ida, are you there? Perhaps we've lost her connection after all that build-up. There you are, Ida. Are you going to present, or would you like me to beam your slides? There she goes. Okay, Ida, over to you. We look forward to the presentation.
Okay, thank you, Gemma. Okay, I will make my presentation on the following theme: supporting meaningful community engagement in grant-making negotiation in Burkina Faso, Burundi, Mali, and Niger. National Country Dialogue Facilitator model. First of all, we will see what is the issue of COVID-19 in Francophone Africa region. During this COVID-19, we have seen in our region a slowing down of health activities in the field, especially the supply of countries, health structures, and population with drugs and other input. And also, this it has some consequences in the maintenance of HIV, tuberculosis, and malaria control activities. And we have seen also that the community involvement in patients was very important. And we can see that in taking into example the body that are put in place in DRC. We have also seen an adaptation of interventions in COVID-19 context. And for instance, in Niger, in the context of COVID-19, preserve the achievement of the fight, community workers continue chemo prevention of the fight against malaria while respecting the measures recommended in the fight. The distribution of chemotherapy has been extended over a long period to limit displacement by continuing the fight. And in Côte d'Ivoire also, we can take an example of training of community health workers and provision of individual health equipment, with the integration of awareness on COVID-19 to the actors involved, but also to the beneficiary population. So using community channels is a very effective way of raising awareness. We have also an issue of stigmatization, and we can take this in the context of the fight against TB and COVID that have some common symptoms like coughing for TB and COVID. And for also malaria, we have a common symptom like fever. How did we respond to this issue? In the Francophone Africa platform, we made many activities, but a specific activity that has conducted is to recruit some local consultants, facilitate the participation of civil society actors in the global fund processes. And this has been done in 4 countries, that is Burkina Faso, Mali, Niger, and Burundi. And through this recruitment, we have seen that we made some specific activities like the participation of civil society actors and communities in country dialogues at all levels. We also organized some civil society workshops in the 4 countries, and also we support the organization of some consultation meetings in those countries. What changed as a result of our intervention? Through our intervention by the recruitment of the civil society facilitators in these 4 countries, we were able to, civil society were able to meet during these workshops, in-person meeting and also through virtual meetings. And we see that if all the organizations have been involved in the country dialogue, it is clear that they are excluded from the process as soon as the funding request is completed. This supposed to allow them to meet after the funding request and to do the midterm review of their participation in the process and to make recommendations. We also see that there have been some weaknesses that have been known from the countries. For instance, question of accountability for Burundi and for Mali. And this is due to the lack of a coordination structure for civil society in those countries. We had also some specific recommendations that have been made according to each country. For instance, for Mali, Because of Mali, we have the need of strengthening the civil society representative of the CCM Mali. Because, for instance, in Mali, they have only one seat for key population on the CCM Mali. This recommendation was made. For instance, again, in Niger, there is a need to set up a mechanism enabling the DEC platform, that is a civil society platform, to participate in the selection and evaluation of recipients and consultants for the community component of the Global Fund. So we see that through this intervention, there were specific needs to these 4 countries that has been raised, and civil society were able to meet and make those recommendations addressed to CCM and other partners. Thank you for your attention.
Merci, Ida, and thank you for sharing this interesting model. So well done, we're right on time. So I want to congratulate our speakers for their efficiency to keep us exactly on track with our schedule and leave time now for more discussion and dialogue. I'm going to go to those who have patiently waited with their hands up from the first session, and then I'll go to some from the chat. So Nazneen, would you like to go first to either react to the presentations or share something of your own? And thank you for your patience.
Thank you very much for giving me the opportunity. I'm Dr. Nazneen Akhtar from Bangladesh. I'm the Oversight Committee member, and my engagement in HIV/AIDS field quite longer, for the last 25 years in different and diverse way, other than a member of BCCM Oversight Committee. So coming to the fact is, like, this COVID has brought a different dimension to this HIV/AIDS program, and it's any program, of course, not only HIV/AIDS. So the changes that we are possibly made so far in any developing country, and Bangladesh is one of the examples for that, because we are just in an upper stage of developing, so we are going to be towards the mid-income country gradually. So that change was really remarkable over the period, but the COVID brought us back. There again some of the gaps started, certain of the vulnerabilities. So if I recall some of the points from the exaggerated vulnerability that has been mentioned just a few minutes earlier from some of the questions raised from some of the participants here. So this exaggerated vulnerability is basically, happened because of the disrupted workflow, of course, and that disrupted workflow has caused some kind of visible problems over. If I see here, like the MSM, the transgender, the sex worker community, visibly the IDU, they become more heightened now. So where they are. And the MSM and transgender, I found that on the street when I crossed through, it is very unusual, their visibility. They just change their kind of, pattern of livelihood. So they're too much on the street without any mask and anything. So, one way the HIV vulnerability was there. Now COVID has added another dimension to them. Another way, the program is totally disrupted in different formats. So I was thinking, whether we should think about this HIV fine, but the COVID and HIV together, more kind of some comprehensive redesigning of the program, and Global Fund may not be enough. Some of the COVID-related fundings are available across the globe. So some of the COVID fund can easily be redirected, particularly to this pocket vulnerability, because these are the people where HIV already spent a lot over the years. We have some setup, some communication, some rapport to those kind of people community, okay? So instead of COVID funding going differently, separately, better to be redirected through the Global Fund, where it is easy to catch up this pocket vulnerability. So it is much more management efficient. It's more kind of best investment, I must say, just because we can add some awareness aspect of COVID alongside with that community who used to deal with the vulnerability for global for HIV/AIDS, tuberculosis, and malaria. So coming to the awareness, and when the vaccine will be available by the time, so you have to cover up them also with the vaccine. So that is much more easier because we have the access. Already the program is in the field for many years. So that make a lot of sense, instead of rebuilding or remanaging the whole thing from the COVID point of view. So just combining these two from the initial thinking from the next cycle of funding, maybe we have to think more redesigning of the program, more deep angle, like maybe we can go for another sort of civil society engagement discussion anytime, how we can make more meaningful engagement, more redesigning. That can be a question, but combining Global Fund with COVID funding and redirecting COVID funding is very timely kind of thought, I think, from my end. And also for the gap filling, we have to think about, like, because when you go back to the basics with some of the program, like even the normal attention which we are disrupted. So for the extreme vulnerability, this has been disrupted. So automatically some of the indicators went back. If you go for a survey after the COVID-19, like at some point in time, you will see that it will become more visible. So that will make sense. Now the question is how to fill up those gaps. So you have to think about some of the expanded programming, some of the deepened programming, some of the redesigning alongside with COVID, and also pulling those kind of negative indicators again towards positivity. So that is a very deep end thinking around this reality, because some of you are very connected. Okay, cost efficiency is there because we are making Zoom meeting and all this, so many people across the globe can join. So this is one way, like an efficient gain of resources. Another way we are deficient because for the field program we are somewhat disconnected, we are disrupted. So one way efficient management of funding, another way there are some kind of inefficiency because of the cost by the fact by the COVID reasoning. So we have to make a balance of the two, and that needs a lot of deep thoughts, what I feel. I just shared the concern.
Thank you.
That's
Thank you
Thank
so
you
much,
very much.
Nazneen. I think I like what you said. It links with what RD was saying about it's no surprise why HIV, TB, and malaria communities were the first to respond to this pandemic. The infrastructure of strong community systems is not disease specific. It's something we need to invest in for many of these reasons. Thank you for that intervention.
Thank you very much.
I'm going to go to Shyamala next. I saw you had your hand and then I think you dropped off. So I see you have your hand back up again. Shyamala, would you like to go ahead? Thanks.
Thank you, Gemma. I'm from India. I'm from the India CCM, CSO representative and a vice chair. First of all, I want to congratulate all the speakers for bringing out such remarkable insights from their experiences over the last 8 months. And these resonate very strongly with the experiences in India. Second, I have to say hats off to the Community, Gender and Human Rights Division of the Global Fund for recognizing that it is very important to now have these wide-ranging conversations and look at how we can institutionalize responses to some of the key issues that are being raised again and again and again and again. Having said that, let me get to the fact that there's a remarkable similarity about the sorts of issues that have been identified by speaker after speaker. Now, everybody has talked about issues related to money, income, to homelessness, to food, shelter, violence, access to healthcare, mental health. These are some of the broad things that are coming. And if you see, these are clearly areas that fit very nicely into the understanding of what social determinants of health are. And a lot of the time, we have pursued the actual indicators of specific diseases rather, and perhaps not paid sufficient attention to looking at what these determinants, the state of these determinants are in the countries that Global Fund is supporting. So I think the first thing is, so anyway, the next point that is again very obvious from all the presentations is that the majority of the responses have been voluntary responses by community organizations or by NGOs or by civil society groups. They've raised private donations, they've drawn upon their friends and family and their personal resources. Where are the government responses? Where are the large donor responses? Where are the more institutional responses? This is something that we are not seeing, and we have not seen, including in India, over a longer period of time. So it's wonderful that we are now addressing it with the Global Fund. The third point is that where institutional responses have in fact happened, as in India, they have largely missed, and perhaps this is true of other countries, they have largely missed criminalized and marginalized populations. So if you're looking at sex workers, if you're looking at LGBT communities, particularly, or drug users, they're off the radar for various reasons. So coming to the point that I wanted to make is, one of the most ambitious and the most enlightening documents that I have had the good fortune of reading is the Global Fund vision document and the concept document on community system strengthening. It details the kinds of actions along with examples, and it talks about the primacy of CSS and the primacy of rights and gender responses. Having said that, we need to see an equal commitment in terms of allocation. How do countries ensure that minimum levels of allocations are made into these components that we all talk about? We can see from the COVID problems that clearly, while we all pay lip service to this, in terms of actually having put in place those rapid response mechanisms, we're still stumbling because people are still responding in their private capacities or in their community capacities. The second point, I think, is that Global Fund is also supported by donors, and donors do have a focus on meeting 95, 95, 95 targets, and that's understandable. How do we help Global Fund to be able to integrate these very important determinants that we have now seen, so that the next COVID or TOVID or ROVID or BOVID that comes along doesn't simply dismantle things and really really delay all our responses. So the third point, many people here have talked about capacity for communities. And of course, that's part of CSS. But I'm talking about something very different. If you see the CCM, again, many people have said here that in many countries, especially Jill's presentation about the responses in terms of how CCM members have either been informed or not informed or so on and so forth. Now that varies, but clearly it's been very, very low across the board. I think one of the things that Global Fund has to do is to build capacities of community and civil society representatives to actually participate meaningfully. What does meaningful participation mean? What are those indicators? Where are the budgets for that kind of participation? Languages are different. All your documents are in English. Some of us spend hours and hours translating, summarizing, pressing, inviting people, sensitizing. This is not sustainable. So two things I can think of in strengthening CCMs, because these people are the only, let me say this again, are the only elected representatives. Everybody else is there by virtue of their position, or they are nominated for other reasons. But elected representatives have the least capacity to participate because they come from marginalized communities, they don't have languages capacity, analytical capacity. So I'm suggesting a budget allocation as one, minimum budget that is actually prepared by community representatives. And second, you see, CCM secretariats should have a co-focal point or a co-person there who are from community representation and from civil society representation, so that we have equal capacity for negotiation, for discussion, for understanding with the Global Fund when these things happen. My final point is this, that in all country CCMs, we have seen this, that the weightage of civil society and community engagement, the proportion of votes is far lower than the proportion that the other non-community, non-civil society members make up, especially communities. What can we put in place to ensure that there is greater equitability? Because people have said that they have brought up priorities that have not been included. Some people have written dissent notes that have been ignored. And yet proposals have gone without including these things. In this instance, I have to conclude by saying that India and the civil society and key community representatives are hugely, hugely grateful to the Global Fund, because we reached out directly to the Global Fund saying that we have a real problem, we need help with social protection, and they immediately responded directly to the key population networks, asking us to put in a proposal through the CCM that has just gone to the Global Fund. Thank you very much for this opportunity.
Thank you, Shyamala. That was a very, very effective intervention, and you're helping me write my report by summarizing all the key points that came out of this great discussion. I really like that, and especially the point about community engagement is not free. These are initiatives that we have to resource, and communities we have to support to do this work. So thank you for that. Thank you very much for that. I'm going to come to Moses next. I just want to highlight a couple of questions in the chat and see if folks can respond in the chat. And then I'll come to you, Moses. So a question from Indra Mohan from Mongolia, asking questions about how do we do community-led monitoring when we're concerned about the accountability question. Global Fund resources being diverted from HIV and TB towards COVID. Violetta had some good advice, and I know that accountability is a key theme in this webinar. Ivan, Ida, Mlewa also mentioned. So any advice you can share with our colleagues in Mongolia? How can we ensure the resources we secure are maintained for our priorities? A question Ida is also asking about the Botswana experience, and maybe Nana, if you're here, you can also chime in the chat. How would you attribute the success of the Botswana C19RM funding request, which is really one of the best examples for having community priorities included? We heard some examples from the presentation, but if you have others, please do share. And Mick had a question. I think Ida's responded to that already. That you know, the model of the country dialogue facilitators. It was an initiative of the platform to design it that way. So I'll encourage that dialogue to continue. Okay, Moses, sorry to keep you waiting. You've also had your hand up for ages. The floor is yours.
Thank you, Gemma. Many of the things that I was going to say was said by Madam Shyamala. I would like to echo what Mick has already said by saying that the community funding is very low during from the Global Fund. During this COVID time, the services of harm reduction was greatly disrupted, even in our country. And the community was the first to jump to their feet to help out with the service disruption. And for the community to do their work, they need something to help them in this endeavor. So I think the Global Fund can look into the funding of the community more. And the last presentation in the first session said that the community fund request is very low, which means that there is a very low, I don't know, knowledge within every country that the community can directly write to the Global Fund for fund allocations. And also that maybe the country CCMs can build more platforms for the community to highlight or to share their voices and the voices to be heard. So I think the participation of the community can be increased more in the country CCMs, and there is some kind of I think because of this COVID situation that the Global Fund has also given a lot of attention to COVID, but if Global Fund is going to be more engaged with the larger health portfolio, is Global Fund going to give importance to TB, HIV, and malaria? Those questions is also overhanging. So thank you so much.
Thank you, Moses. And I'm so glad that so many CCM members are here today because we need to connect all of these initiatives together, right? And making sure that the representatives are aware of these good examples, difficulties, so you can advocate is so important. So thank you for reminding us of that key point. We have another Moses, Isaac Moses. You are up next. Please go ahead and share your thoughts.
All right, thank you, Gemma. Can you hear me now? All right, great. So Isaac Moses, and as usual, I'll be speaking for the AYP community, which I represent and work for, and I'm from Nigeria, representing NINETA and ANITE. All right, so my own comment goes thus. I've seen clearly that Global Fund has very good strategies and good policies in place that should be addressing the needs of adolescents and young persons in their diversity. That's a whole lot of document, very good one. And of course, there are still a lot of consultation as regards to how the next strategy will be developed. But however, from my engagement so far, we have clearly seen that some of the strategies in terms of implementation and in terms of results, we still do not get tangible results as it reflects the needs and priorities of adolescents and young persons. That's really a big gap that we are looking at, especially in this COVID-19 era. Over time, we've seen that young people are not taken seriously, and then we are only seen as beneficiaries rather than being on this decision table. Like we've always said, that there is nothing about us without us. So let me use a case study like the Nigerian situation. Early this year, before the COVID-19, we got the TA support from the Global Fund. For the first time, it was the AYP and AYP-led CRG that started in Nigeria through ANITE, Adolescents Network for Young People's Development in Africa, African Network for Young People's Development. Now, we did a lot of consultation across the 6 geopolitical zones. We connected, we were in touch with the CCM, we're in touch with most of the partners, including the government. We came up with a position plan, and then we saw some of all the gaps we highlighted, we presented, we shared the reports at a broad platform with all of the partners and the government. Then when it was time for the grants request, we tried as much as we can doing all of those engagements to ensure that some of those things are captured. Now, at the point of grant making, where it has to do with the implementation arrangements and the likes, it's so amazing that at that point whereby it is not enough saying that we are casting our votes, but we need to count the votes. That was the point of counting the votes. It's so amazing that after all those work done, after all of the engagements, no AYP CSOs was even given the opportunity to be an SR, not even SSR. That is to tell us that young people have been left to be just beneficiaries. And at the end of the day, we still did not get the results that we need to address some of these needs and the priority. And of course, some of these things are happening in the CCM. So my concern is that it's not enough for us looking at how the COVID-19 has actually impeded a lot of our programs, affected our programs. But even before the C19, there is so much gap. And the politics in the CCM is becoming so much that the communities are being marginalized and disenfranchised in terms of coming to the decision-making table to ensure that their priorities are being captured, and then at the point of implementation, those results are really achieved. So I'll be saying that for the Global Fund, it is a high time that we begin to look at young people take us seriously, because that community is so large, and then it has a lot of diversities. You know, we talk about AGYW, we talk about the AYKPs. We also want to talk about the adolescent boys and young men, because it takes two to tango. So a lot of attention is always going to adolescent girls and young women. But how about the boys and the young men? So many things are happening to the male counterparts as well. And then this disconnect is still there. So Global Fund needs to look at all of this to say that, look, it is not enough just saying the CCM secretariat should just be managing, and then the country portfolio manager should just be handling some of these things without having young people adequately represented. So that's my own point. And Global Fund from the Global Secretariat need to start looking at how young people's needs should be prioritized. And just to summarize that, we'll agree with us that during this C19, considering the fact that young people are the most affected, a lot of young people have gone through so much. And then as we speak today, most of the survey that are coming up, most of the survey are happening virtually. We presented a TA to do some kind of real engagement in remote areas, in hard to reach communities where we have a lot of young people that do not have the technical capacity to link up with engagement using remote and virtual tools that are available. And that TA was not supported. And if I look at most of the surveys that are coming up, you realize that they're either from NGOs, from CSOs. Everybody is just sharing their experience as it affects them without looking at what is happening at the grassroots level. The people at the grassroots level, and a lot of young people are there. They are economically marginalized, and then technically they don't have the capacity. So if we are saying that, yes, we understand that, yes, that the virtual platform, we need to think virtual is being cost effective. However, we also need to strengthen the community so that they can do real-time engagement, especially in those remote areas. And I will still say it, if we all are really taking note of what is happening in the inner communities, in the inner cities, a lot of young people are deeply affected. And we need to see how communities are strengthened to ensure that this engagement just do not end up here virtually, where we just keep talking and then it's just all about discussion. At the end of the day, we'll start talking about budgets, and at the end of the day, these budgets still will not reflect the needs and the priorities at the grassroots level. So I think Global Fund needs to look at that so that we are not just shortchanging and disenfranchising large population, and we think we are doing so much, and it becomes same data and then different story entirely. So at this point, I would like to submit. But of course, Gemma, I need you to look at the Nigerian context. It's so much politics right now in the CCM, and it's not something that we are really happy about in Nigeria, including the CCM themselves, the portfolio manager, and then the government. As I speak to you, a lot of CSOs are short of the entire process. And this is not what Global Fund stand for when it comes to transparency and accountability for the communities that they are trying to impact lives into. Thank you very much, Gemma.
Thank you for sharing your challenges. And I think what you said about engaging people in the remote areas is also a really important one. We always talk about that difficulty, and at least with moving virtual, I hope that we can find ways of doing that better as one of the silver linings. I want to apologize to those who have their hand up. We need to wrap up now. It's been a long session. I'm just going to ask our community engagement lead, Gavin Reed, to come and just say a few words of closing as we end the session. Over to you, Gavin. Thanks.
Great, thank you, Gemma, and thanks for everyone's participation, and particularly the platforms who have organized the webinar and made the presentations. I think it's so impressive, as always, to see the range of really creative, proactive responses that communities always take and have taken to ensure ongoing engagement in global fund related processes. As always, communities are absolutely key to ensuring line of sight on impact on those most vulnerable to COVID and those most impacted by the disruption that COVID's having on HIV, TB and malaria services, as well as to broader health and well-being. And we've also heard about issues around access to clear information, food, income, social protection. It's also our ongoing challenge that, as always, we still seem to need to justify the role and value out of communities in responding to COVID. And we really are committed to working with you to highlight the challenges to colleagues in the Global Fund and to ensure that our responses are able to meet needs, are able to ensure the participation of communities in shaping the requests and ensuring that community-led responses are properly supported. I'm really impressed to hear, how the communities are not only just conveying some of the realities and the challenges that are being faced, but also whilst doing work on the ground to immediately respond to those challenges. And I really encourage you to continue to escalate issues to country teams, to the CRG department, but also to the regional platforms and key population networks, to raise them with your CCMs and the board delegations. I think that it really does require a multi-channel response. We've heard that there are clearly some opportunities about how we connect and work remotely and learn to advocate remotely. And I think that some of the key learnings around the importance of having community systems and investing in community systems and how these have enabled communities to be able to respond quickly and adapt, whether by the emergency response cells that we heard about to deliver ARTs, or in being able to conduct surveys to capture the effect and the importance of, for example, having simple, accurate information that's understandable around COVID. I also think that there's some opportunity around how some of the adaptations around community-led services and multi-month scripts and delivery of services and community, how these could be adapted in the longer term. I think there's an opportunity for these practices that we've been advocating for to ensure that decision makers in countries are adapting these initiatives, not just as short-term responses, but for the longer term. And as several people have addressed, that COVID is not highlighting new inequalities, but is actually amplifying existing inequalities. And here, I really think it is about how do we work together more purposefully with more energy to address the underlying structural barriers, including laws and policies that amplify these inequalities. We recognize that there's challenges around the model, the CCM. I would encourage communities to make access of the 15% of the CCM budget that is allocated to communities and civil society. And also the CRG department is working closely with the CCM hub to be able to deepen our work around CCM and the engagement of wider and more inclusive communities in CCMs. And there'll be more information coming to that through the platforms and the key population networks that we work with in the CRG SI. We're really committed to supporting further dialogue around COVID, and would be interested to know how we could help in continuing the discussion. We know that discussions are happening through, multiple partners, and Global Fund is just one actor. We're here to support if need be. And we'd really encourage you, as you've seen in the chat, please reach out to Gemma or the regional platforms and tell us what would be useful for us to continue to support the conversation. I'd also really like to thank the 6 regional platforms who are our partners in the Community Rights and Gender Strategic Initiative for this excellent webinar, and Gemma for her superb facilitation, as well as all of you for your participation. So Gemma, I think I'll probably leave it there for now.
Thanks, everyone. Thank you, Gavin, and thank you, colleagues. I really enjoyed this. We learned a lot. All the recordings and slides and chat will be shared, and let's continue the dialogue. We hope this is an ongoing discussion. Thank you for your time, your ideas, and your engagement. Have a good afternoon, evening, morning, everyone. Thanks very much.
Bye.
Bye.
Bye. Thank you.
Thank you, Gemma. Thank you very much.
Cheers.